Hi, my name is Anita, and I wanted to provide a brief introduction to the operating room. You can see a diagram here. Here's the room. And here are some important elements within it. You can see a double door or a wide door, and this is for the patient bed, and a single door that'll be off to the side, sometimes leading to a substerile area or just leading back into the hallway of the operating room suite. Generally, once the patient bed enters the room, you don't want to use these double doors until the patient is out of anesthesia and you need to get the patient bed back into the room to retrieve the patient. Here's the operating table you'll see here, as well as the anesthesia equipment that'll be at the head of the bed usually. There's the tables used by the scrub nurse here and here. What's important about these is that once they're draped and the patient's being prepped, this is what's called the sterile area, where the attending surgeon and the scrub nurse will be, and you don't ever want to step in this sterile area unless you're scrubbed in. There's also the table for the circulating nurse and the whiteboard, which will become important in a second. Here are some of the important people that you'll meet in the OR. This you see here is the circulating nurse. He or she is not scrubbed in, and he or she has many important jobs, the most important of which is prioritizing safety of the patient, getting on and off the table, and also keeping a track of tourniquet times, different timings that need to happen during the case. And he or she will also hand off sterile items to the scrub nurse. The scrub nurse is the first person to scrub in and will help you get your gloves and gown and help you to scrub in during the case. And he or she is responsible for all the equipment during the case, keeping a track of it, keeping everything organized, and also anticipating what the attending surgeon needs during the case. This you see here is the attending surgeon. No explanation necessary. The assistant surgeon, there can be one or two of them, and can be pretty much anybody. You might see a resident or a fellow or a physician's assistant, or it could be you or another medical student if no one else is there to help the attending surgeon. Finally, you'll see someone delivering anesthesia to the patient, and this can be an attending anesthesiologist or a resident, or sometimes will be a CRNA. And you probably know this by now from clinical immersion, but if you're not scrubbed in, there's an anesthesia curtain that goes up between anesthesia and the sterile field. And if you ask nicely, you can get a step stool, put it right here, and then kind of watch what's going on around here. So those are the most important people that you'll meet in the OR. Sometimes it'll be a vendor. Sometimes it's nice to talk to them. They've seen so many cases that they can describe to you something that's going on if you're not scrubbed in and want to talk to someone. Now I want to talk about the 5 important steps you need to complete every time you enter a new OR. As a medical student, what you need to remember is that you just need to act like a mini resident, and that includes treating everybody in the room with the utmost respect, and also just trying to anticipate what a resident would need to do in the room to help out the resident as much as possible. So when you first enter the room, you want to introduce yourself to the circulating nurse and the scrub nurse. And it's important to do this before the patient enters the room because they have a job to do themselves and will be occupied with maximizing patient safety. So come in as early as you can before the case and tell them your name. The next thing you want to do, comes pretty naturally, is to write your name down on the whiteboard or on a piece of paper that the circulating nurse can easily find. The reason for this is that the nurse needs to keep a track of everyone who's in the OR, even people who don't scrub in, and writing your name down just makes it that much easier for him or her. As an aside, as a medical student, you're one of tens that will be in the OR during that month. So it's really hard to remember your name, and it makes it a lot easier for everybody else if they can just take a glance at the whiteboard and be able to call on you if they forget your name. The third thing you want to do also before the patient enters the room is ask for permission to scrub. You always want to make sure first that the resident's okay with it, because if the resident's okay with it, the attending is probably okay with it. And then you want to ask the scrub nurse if it's okay as well, because you'll be giving your gloves and gown to the scrub nurse. Now, you should have gotten your correct glove sizes during orientation, but if you're not sure of what your glove sizes are, you can ask the scrub nurse what he or she thinks you'll go for. And usually you'll double gloves, so you want to get out 2 pairs of gloves and a gown in your appropriate size, and those will be in the cabinet in the OR itself or in the supply closet. The fourth thing you want to do, and this is sort of optional depending on the case, is pull up relevant imaging. This is especially relevant for orthopedic surgery or ENT or bigger general surgery cases where there's some pre-op imaging, usually something that the resident does, but if you ask the resident for permission first, so you can get the patient MRN and pull it up on the computer ahead of time so the resident doesn't have to. Very, very helpful. The last and arguably the most important thing is to meet the patient before the case. This really is something that a resident should be doing and something that you should get used to doing too. Meet the patient, introduce yourself, tell them what your role will be. Just tell them that you'll be observing the attending operating in the OR, and it's for educational purposes. It's just a nice thing to do. You want to meet the patient in pre-op as soon as possible. Right before they get rolled in, they'll be given mild sedatives, so they won't be as coherent if you wait till they're in the operating room. And you can do this with the resident when the resident goes to meet the patient to check the consent form, or you can do it whenever you get done with these first 4 things.